Good afternoon. My name is Rob Hill. This is Michael Thorne. We're here today to present to you the Laxo device, clearing the path to improved or better surgical outcomes. Patient arrives at the emergency department complaining of severe abdominal pain with nausea and vomiting. Workup reveals a small bowel obstruction requiring a bowel resection with the placement of 2 drains. Postoperatively, the patient condition deteriorates and they become severely ill and septic. Imaging reveals multiple abdominal fluid collections and that the 2 placed drains have become occluded, resulting in ICU admission, replacement of the occluded drains, placement of additional drains, increased length of stay, and a substantial cost burden to both the patient and the healthcare institution. The problem: drain occlusions hemorrhage healthcare dollars. 95% of surgical drains become occluded within 2 days, resulting in over $1 billion of lost annual revenues from operations needed to manage complications from the occluded drains. Michael, what's the solution?
Well, the solution is the Laxo device. Rob and I are holding it right here. The Laxo device is aimed at eradicating the stagnant fluid collections that accumulate within these drains by compressing and gliding down the tube. There's no threat to integrity with the device. It allows for simple cleaning. It's cost effective, ease of use, and also it's patented. Why us? We're disruptive innovators within a collaborative ecosystem. We're nurses, so we're able to see the problems when they first occur. So why now? Surgeries and drains are here to stay. The healthcare system is transitioning to value-based reimbursement, and hospitals are nearing capacity, and that's not going away anytime soon. 700,000 surgeries are performed in the country that require postoperative drains, which allows us to tap into a market where exceeds $1 billion. If this device was marketed at $6 and the cost of manufacturing is 30 cents, and we can achieve 25% approval of that device being included within one healthcare system, we could achieve profits greater than $1 million. What's sustainable and adds value? It's clear that the Laxo device does. Our ask is to seek mentorship in this space to help provide professional guidance as we go through our journey with this device and bring it to market. Thank you.
Well, that's terrific. You identified a very substantial need. You're asking for mentorship. What are the precise questions that you're looking for? Is it the business aspect, or is it going through the regulatory aspects, or just coming up with a better cleaning method?
So I think what we're trying to achieve is trying to figure out the best way to get this to the bedside. Is it through a licensing channel with the device manufacturer, or do we directly license it to a surgical drain manufacturer at first? Secondly, is the compliance and just the FDA roadmap that we would need to achieve to bring this to market, because essentially we want this being used in the hospital, but then also for patients to use when they go home with these surgical drains. And that's what we need guidance with when it comes to FDA clearance.
How much more effective would that device be at clearing the drains than the standard of practice for clearing those drains?
Current standard of practice for clearing the drains is taking your fingers and running it along the drains, or taking a pen or something else to run along that side of the drain. And we do find that that's not nearly as effective as utilizing the Laxo device, as it allows for complete compression on both sides of the drain without completely clamping off the drain, if you will. Moves it along nicely, and it's also more beneficial for folks that have issues with dexterity, arthritis, those kinds of things. So certainly much more user friendly than just the fingers alone.
So it sounds like you see an opportunity for both use in the hospital during and post-surgical procedures, as well as for at home. Do you anticipate that the ease of use of your device will be such that anyone can use it, or will there be some training or some additional education required?
I think that for patients going home, most certainly would need some additional training and guidance on proper use to ensure that they're not just clamping and removing their drain with the pressure. But I think that the education on that component would be pretty simple, as we do already educate patients and families to do the manual figure drain stripping.
During And during customer discovery, we found with patients as well as nursing staff that empowering the patient with a tool to go home with to effectively clear their drains out was far more superior to just learning how to tactilely learn how to do the drain. Giving them a device definitely empowered them.
Just one quick follow-up question. Your profit margin really will be taken away by the complexity of actually selling the device. That's where most of the cost is going to come in, but also somebody just ripping you off, having a slight variation on your theme. That's the first thing you want mentors for, I think.
Yes, sir.